MagnetisMM-4 is one study out of several trials that is based on the bispecific antibody Elranatamab. That's a BCMA CD3 targeted antibody for multiple myeloma. The MagnetisMM-4 trial I present here at this ASH meeting as the first author on behalf of the whole study team. It has two parts. There's a sub-study A and a sub-study B. In the sub-study A, there is both a safety component and then there is a efficacy component. So in the first part, we're looking for toxicity and safety signal, and in the second, the primary endpoint is overall response rate. In that part, both in the safety and the efficacy part for the sub-study A, we combine Elranatamab with the gamma secretase inhibitor. And this was based on initial discovery work that Damian Green did several years back ago at the Fred Hutch, when he showed that myeloma cells can use shedding of BCMA as a protection mechanism or a way to become resistant to these classes of drugs. So for that reason, we're combining the antibody with the gamma secretase inhibitor. The sub-study B uses again Elranatamab, and now it's in combination with Lenalidomide and Dexamethasone. And here the focus is also on efficacy, but we of course capture safety data as well. The inclusion criteria for these two trials is almost identical, and it's very similar to most other trials. But there is a slight difference between study A and sub-study B when it comes to the previous exposure to BCMA. So for sub-study A, patients cannot enroll if they have received a prior antibody going after BCMA. That could be an antibody-drug conjugate, for example, but they could have been exposed to, say, a CAR T cell for BCMA, they still would be eligible for the trial. For sub-study B, no prior BCMA therapy would be allowed.